My name is Kevin Hicks. I'm a field marketing specialist for Axonics and will be moderating this webinar. This evening, Dr. Pierpaoli will be speaking about stress urinary incontinence, the common symptoms patients experience, and treatment options that may help you gain control. Without further ado, I'd like to introduce Dr. Stephen Pierpaoli. Dr. Pierpaoli?
Good evening, Kevin. Good evening, everybody. Thanks for helping us set this up so we can help educate patients. We're going to have a talk this evening about stress urinary incontinence and various treatment options that are available. So without further ado, we'll start. There's some safety information slides that we have to go through, and basically the Bulkamid system, there's a few things that we don't want to do with it. One is putting it into the vasculature, and if people have acute urinary tract infections, there's a lot of verbiage here, but I'd like to have people take their time and read through this since this is an important part of making sure people understand it's not a completely procedure without any risk. And basically more of the same, and talks about the potential adverse effects, which mainly, and which is the nice thing, which we'll talk about further on, as we get on in the talk, is there's really no, major complications. Some people can have mild pain from the procedure transiently, risk of urinary retention and urinary tract infection. But overall, it's a very safe procedure with a quite good efficacy, which we'll go through further in a little bit. This is a little bit about me, and we won't. I'm a board certified urologist in the south suburbs of Illinois, and I practice with Associated Urologic Specialists, and there's a few where I studied, etc. So when we talk about, urinary incontinence, then there's two really different types of urinary incontinence. Tonight, we'll be talking mainly about stress urinary incontinence, which is really, cough, sneeze, laugh. I have some patients that say, well, I'm in my exercise class and I do jumping jacks and I leak. That's what stress urinary incontinence is. And there's a large proportion of women who develop this as they age, and there's various risk factors for it. This talks about, the bladder is basically what I tell my patients is a suitcase, and it stores urine and that has to empty urine, and that most of it is mediated by the brain. And what keeps the urine in is the sphincter that is below the bladder, and that's a muscle. How can that muscle be damaged? Well, it could be damaged by age, people who have had multiple children, typically vaginal deliveries would be the worst. People who have had prior pelvic surgery where the ligaments and muscles can be damaged, and that's why people start to leak. And older women, it happens because the tissue sort of loses some of its elasticity, and it's a fairly common problem as women age. Estrogen levels decrease and there's less bulking around the urethra. From the normal bladder then has to empty. The bladder is a muscle, just like any other muscle in our body. It has to adequately contract and the urethra has to relax. What we don't want to have happen is the urethra to be relaxed when the bladder is full, and that's sort of where stress incontinence comes in. And again, stress urinary incontinence, you can see on the top left that the sphincter is closed and the urethra is holding the urine in. I explain to my patients it's like having a washer. And sometimes, unfortunately, it gets weaker because of some of the things we had just talked about, and that washer can't keep the urine in. So if the bladder gets full too much, or we laugh, cough, sneeze, exercise, or pick up something heavy, bringing our groceries in, we leak, and because the muscles aren't as strong as they need to be. So this is helps us when we have patients with stress incontinence versus urge incontinence, the questions we would ask to try to figure that out, because urge incontinence, that will not, if we tighten the sphincter, if we have just primarily urge incontinence, it's not going to improve our stress incontinence. So we have to make sure we make the appropriate diagnosis before we start doing any type of procedures. It's a very common problem. And about 30% of the population, female population, will develop it at some point in their lives. I do think, people who have had long, labors, There's some suggestion that we may damage the pudendal nerve, which then is going to play a role with the way the urethra collapse or closes, and that wash or weakens, and then we can have issues with leaking. And then, change in hormones as women age is also an issue. Many people, I see them in the office. It does change your women's quality of life. So, with self-esteem issues, depression, and anxiety. I have some patients who really won't want to go out of their home because they're very concerned that people can see that they have some type of, protection pad on. As we age, and if we're sitting in pads all the time, it could increase our risk of urinary tract infections or skin breakdown, and certainly a bigger issue in patients in nursing homes and whatnot, getting bed sores and things of that nature. Changes how productive we are. If you have to go upstairs and change your underwear, or you're at your children's parent-teacher organization and you have a leakage, and you have to come home and you missed a meeting. And it certainly plays a role, I think, from a sexual nature with your partners. And sometimes it makes you not want to interact with your partner because of the concern for urinary leakage. And then I'm sure anyone who's on here, the companies that make pads, diapers, or et cetera, are making large volumes of money because they're not cheap. And unfortunately, it's not covered by insurance on most occasions. So it's a real problem. But there are treatments, guys, and that's the good thing. And we're going to go through the various treatments. And I tend to look at things, let's start easy. Okay. Pelvic floor exercises. And I think a lot of people know it by the name of Kegel exercises. That's basically to try to make the muscle stronger. I will tell you, sometimes, especially if there's been, multiple births, it's not really an issue where it can make the muscle stronger. If that pudendal nerve has been damaged from childbirth, then that's going to be an issue where it doesn't matter, I think, what you do. You're probably not going to get that muscle much stronger, but I think it's very reasonable to start with that. Now, we can usually teach you in the office how to do those. There's things that you can buy, like vaginal weights that you can place into the vagina that will sort of get you to contract those muscles. And it's something that you can do at home. Sometimes I send patients to a pelvic floor physical therapist, and it wouldn't be the one that would be working on your knee rehab, but people who are specifically trained to work on pelvic floor musculature. So that's something that I think can help everyone. I think the likelihood that it's going to cure you if you have significant stress urinary incontinence is low. Can it make you better and make you use less pads? The answer is yes. Then we come down and we look at the other procedures that we can do. Is we have, urethral bulking agents, and we have, the surgical sling procedure. And I think most people have heard more probably about surgical slings. They've been around for many years, but then, over the last 5 to 7 years, the issues with mesh. And I think everyone, if I drive down the highway, 2 years ago, there's on 294, there's people, lawyers asking about, have you had mesh? And that's obviously always a concern. And I think we've tried to look for better alternatives that have maybe less risk, maybe not quite as efficacious, but have less risk. And I think that's what most patients would like. When we look at the lifestyle change, I mean, certainly having excess weight, the more weight that you have sort of pushing on the bladder, that makes there be more pressure in the bladder, and we can easily overcome that washer, which has been loosened, with age and the other things we had talked about. Smoking, you cough, you're going to leak. That's something we need to we can control. Smoking is obviously not good for a multitude of, medical issues, but certainly it doesn't help women with stress incontinence. Pelvic floor musculature improvement can be done with the Kegel exercises. And again, we can typically teach you how to do it in the office. There's weights that we can give you, as well as the physical therapist. When we look at the gold standard for stress urinary incontinence is the surgical sling procedure or mesh. And if you look at the picture to the left, you see the urethra. And I explain to patients, it's like putting a hammock underneath the urethra. So when there's increased pressure on the bladder or there's mobility of the urethra, we compress the urethra. Probably 85 to 90% success with 17-year follow-up. The concern we have is women who feel like they want to have more children. can't have it because it's going to, the procedure, you'll loosen it and it won't work. So that certainly is not good in patients who continue, who want to have more children in the future. And then as we talked about the issues with mesh complications, and mesh complications, it can be minor or they can be major. We can have erosion of the urethra through the vaginal mucosa or the lining of the bladder. It can go into the urethra, it can go into the bladder. And that's always something that, we have to be cognizant of going in. It has a very high success rate, but it also has a higher risk profile. To reiterate on the sling procedure, it is not completely without risk, and it has certainly higher risk than the bulking agents that we have available. When we talk about urethral bulking agents, the one that we'll be talking about today is the Bulkamid product, which is a polyacrylamide hydrogel that just by to quote unquote bulk up the walls of that urethra and make the washer tighter. And it's a procedure that can be done typically as an outpatient. I think soon we'll be able to do it in the office under local anesthesia. Right now, currently, I will tell you, I do mine in an outpatient surgery setting with some IV sedation, and it takes about 10 or 15 minutes to do. And basically, we want to bulk the urethra up, and a little needle is used to inject this medication in the mid-urethra underneath the lining of the urethra to sort of make that faucet tighter. The nice thing about it is it can be done quickly. There's usually about a 24-hour downtime. We talked about some of the potential risks before, but the nice thing is when we look at this, we know that there's no major risks as we would see. I mean, it's rare, but when we look at, sling procedures, there's reports of people, placing these sling materials because they're passed blindly into intestine and other organs that could really lead to then another major operation. It's not common, but it doesn't matter if you're that one person who has a complication like that. It certainly can be life-changing. So what is it? It's a minimally invasive approach to treat stress incontinence. It's water-based, so when it gets injected, over time the body will be able to grow into it. And we have the data out to 7 years saying that it stays relatively stable, or it stays stable for 7 years. So if we have a nice outcome, it's going to be there, and it's not going to lose its efficacy, certainly in the first 2 to 3 years.
Bulkamid can help provide the relief you've been longing for. The short, incision-free procedure typically takes less than 10 minutes. Involves 3 to 4 small injections of soft, water-based gel into the wall of the urethra to help prevent urine from leaking out of the bladder during day-to-day activities. It's safe, quick, and most patients can get back to your normal activities almost immediately.
The biggest benefit when we look at something like this is it's a very quick recovery time with minimal major complications. And it's something that's been around for quite a long time. I mean, facial fillers that plastic surgeons have been used, and I think they use some of this material to make contact lenses. Your body does not make, you can't get a reaction to it. So people can't be allergic to it. So I don't want to think that, if you get this, can you have some terrible complication because your body has sort of not, doesn't like it, and you're going to have some reaction to it. That doesn't happen. When we look at the efficacy of it, or how effective it is, about 90 to 92% of patients will be happy. They may not be cured, but I think the majority of patients, if you go down to using 3 or 4 large pads per day, or you have a small panty liner, that's a lot different. And it's I think people feel differently about themselves. I mean, I think the overall cure rate is less than it is for the sling procedure, but about 66% of patients will be completely dry. And, when we looked at the number for the sling procedure, it was, 85 to 90%. So not quite as efficacious, but we have to look at the side effects of sling procedures and the potential risks. It's a procedure that takes 10 to 15 minutes to do. I will say, if people aren't completely dry, sometimes in the first 6 to 8 weeks, we'll do a quote unquote top off procedure to sort of bulk up the urethra a little bit more. Could you develop retention? The answer is yes, but we don't let that persist. We can basically place a catheter and spread early on and spread the gel out, so we'll decrease that resistance. So long-term retention is not something we're concerned about. Again, durability, out to 7 years, with studies still being patients still being followed. I think most people would be pretty happy with that. So it was nice to have everyone join us tonight, and this is our information here. Myself and a number of my partners in the Associated Urologic Specialists do the procedure, and it was certainly nice spending some time with you this evening.
If anybody has questions or is interested in reaching out to Dr. Pierpaoli, the phone number is there for his office. We want to thank you all for attending. Dr. Pierpaoli, thank you for your time.